When the eyes light up, it is actually the brain pathway that has been stimulated that gives that response that the person that you're speaking to recognizes. If you can't see, it immediately puts a limitation on you. In your fetus, at a very, very early stage, you can actually see the eyes developing. And the imprint of the whole body goes via the brain. There's an integration of every part of our body to the brain, and that is reflected via the nervous system on the monitor, which is the iris. Would you like to tell me why you've come to see me today?
Well, there's a history of heart disease in my family, and I just wanted to see if there were any signs and any sort of precautions I could take.
Iridology is a non-invasive form of diagnosis. It can help you to find answers that you sometimes would battle with. So for me in my practice, it forms part of the foundation for every person to actually have a diagnostic analysis of the iris. Both eyes. We look firstly at the constitution. Your basic constitution, the underlying genetic inheritance can be either from a blue eye or a brown eye, or what we term a mixed eye. Your mixed iris shows the transition that we have between the lymphatic blue and the brown hematogenic. Now that would form certain patterns, and from these patterns and the variation of this pattern, we will put it into different constitutional categories. You have what we would term the lymphatic iris with an exudative diathesis. That's very important because the way that you're going to respond, health or disease-wise, would be from that dynamic. Now, the eye areas have been documented over many, many years, and basically what happens is that you've got a left and a right side to your body. If you would take your body right down the middle, everything that's on the left would be reflected, in this case, on the left iris, and everything on the right iris. Each person's individual imprint is so important, and we actually see the inside body structure there. That structure that we see, the matrix structure, is the connective tissue that that body is made up from. If we were to take our skin off, that is what we would see. Iridology had its Western origins in the previous century, when an Hungarian boy actually nursed an owl with a broken leg. After he had graduated as a medical practitioner, he recalled the changes that he saw in this owl's eye. So he wondered whether he would see the same in the patient. So he started looking at the eyes of patients. With the advent of microscopes and more modern technology, iridology at this stage have experienced quite a leap forward, because we can now document far better what we have seen in the past, which was drawn by hand. Now, that means that the benefit actually of an iris analysis is that we can see what the genetic inheritance of the patient would be. We can see where they're at this time, at this moment, and then we can see where the weaknesses of this constitution would actually endanger the patient's health. So we can help them to put preventative measures in place. We will sit down after a consultation and we would work out a plan It is not advisable just to hodgepodge take medication or do something. Everything needs to dovetail in a specific way for that constitution.